So I'll begin by acknowledging the traditional custodians of the land on which we're gathered and pay my respects to elders past, present and emerging. So today we're here to launch our second vaccination bus. By way of just a bit of an order of proceedings, I'll just give a quick update in terms of active cases and where we're placed at the moment, and then we'll move pretty quickly straight into the updates in terms of vaccination and our second bus. I'd like to also acknowledge, we'll have Kim O'Keefe, Councillor Kim O'Keefe, the Mayor for City of Greater Shepparton, will speak as well Chris Hazelman, the Manager of the Shepparton Ethnic Council, and we have had an apology from Felicia Dean, and I'd also like to acknowledge Deputy Mayor Rob Priestley as well. So in terms of active cases at the moment in Shepparton, there's 233 active cases. That number's been in that order of about 220 to 235 odd or thereabouts in the last week or so now, and largely because we're having approximately the same number of people or active cases being cleared as new people are being added. In the last 24 hours, we've had 23 new active cases in the Shepparton area. 14 of those are linked and 9 are still under review at this stage. Household transmission still remains the main form of how the virus is moving around the community, so people really need to pay attention to that, and of course take all the precautions that are still in place for the rest of today, and then as we move out of the broader lockdown restrictions, certainly paying attention to the revised restrictions that come in place tomorrow morning. In terms of inpatients at Goulburn Valley Health at the moment, there's 11 people that are admitted, and 2 of those people are in intensive care, and those 2 people are both on ventilators. So I'll stop there before we move into vaccination if there's any questions at this point.
In terms of the number of people in hospital have obviously risen quite a bit. With restrictions set to ease from midnight tonight, what does that place you in terms of your preparations in terms of future hospitalisations and that sort of thing?
So we're still working on approximately 4 to 5% of the total active cases. That's our general rule of thumb in terms of what we're expecting for hospital admissions. What's being shown in the Burnett modelling that has been shared and done for the Victorian government and being shared is that the number of people that are requiring admission is slightly less, but the number of people that are being admitted to ICU is what was predicted. For us, our plans haven't changed in the sense that we've had really good plans in place right through from the commencement of the pandemic for any surge that might occur, both in terms of cases in the community but also people requiring admission. We've taken the opportunity in recent weeks, and we're still finalising those plans at the moment to accommodate any additional surges than what's expected. But at this stage, the number of people that are being admitted and the number of active cases is largely expected to remain as it is currently. So our plans are in place, but we've certainly got contingencies should there be something unexpected happen where we'll need to admit a larger number of people or require additional ICU capacity. And there's also capacity among other health services in the state as well.
So you're expecting that the number of cases we're seeing at the moment will probably be the steady state, I guess, for the next little while?
It may reduce marginally a little bit. So the peak in this current outbreak is predicted to be in the next 1 to 2 weeks, so particularly next week. Then it's predicted to be a slight decline before another increase. So a decline in early November and then an increase up until a peak around about at the same levels as this stage, perhaps a little bit more, but that's around Christmas Day when that is expected to be. So our plans are really solid, and as I said before, we've got good ability to surge if we need to. All right, in regards to vaccination, so pleasingly as of this Monday in the Greater Shepparton area and many other local government areas that the GV Health local public health unit is responsible for in terms of vaccination, first dose rates are now at or above 95% across our area. So for the Greater Shepparton area, That is now over 95% first dose and 69.4% second dose, which is a terrific outcome. Since we were here around 2 to 3 weeks ago now to launch the Get the Jab Done campaign, we've had a really good result to that campaign. So you'll recall we were aiming to target 5,000 people to come forward for their first dose, and at this stage, as of 2 days ago, 3,921 people had come forward. So that's a really pleasing result, but we now have 1,079 people that we're encouraging to, if they haven't already done so, to book an appointment to be vaccinated as soon as possible. That's really important, of course, as restrictions start to ease, and in terms of us moving towards a more COVID safe and perhaps a COVID normal environment. In terms of what we've seen in regards to vaccination here or across our local public health units, so as I mentioned before, our area covers parts of the Campaspe local government area, Strathbogie, Benalla, Mansfield, Murrindindi and Mitchell Shires, all of those local government areas. So since we commenced the vaccination campaign, we have across that area through our public health unit and our partner health services vaccinated or administered 135,000 doses, and here at the Macintosh Centre we've administered 80,000 doses of vaccine. So that's a really terrific effort, and my thanks to everybody who's come forward to be vaccinated, but thanks to our hard-working teams that have done a terrific job to vaccinate that many people. Since we launched Jabber the Bus 2 or 3 weeks ago now, Jabber's done over 1,500 vaccinations, which is a really important milestone, and we know the significance at this stage in terms of being able to take vaccination out to communities or people who for whatever reason haven't come forward to a centre-based location to be vaccinated. So that's in part why we're here today, because we have, based on the success of Jabber the Bus, we've gone forward with commissioning a second bus today, and I'd just like to thank our partners at Dyson's Group who are working side by side with us and have done a great job to commission this second bus in the last week or so, or 2 weeks since we put the call out to them. So right across those areas that our local public health unit is covering, we know we're going to have to work pretty hard in the coming few weeks to take vaccination to some geographically distant areas, and also to some members of the community who for whatever reason are unable to come forward, and that's why this second bus is really important. So after a really positive community campaign and some really terrific suggestions being put forward by our staff and also by many members of the community, and a voting system which I think underwent the same level of scrutiny as one of our elections, perhaps not quite as such, but nonetheless I'm very pleased to announce that the name of the second bus is Maxine Vaccine. So we'll soon see Maxine Vaccine out and about on the road joining Jabber the Bus in the coming few weeks. So as I said before, I'd like to thank the Dyson's Group for supporting us, and in terms of the features of the bus, it's fairly much identical to Jabber the Bus in terms of Maxine Vaccine. It contains a number of pods, 3 or 4 pods to be able to have people move through. It's got all of the equipment we need to store and safely draw up and administer the vaccine, and importantly, as indeed all these buses are, it's disability friendly. So access for people who may have some needs is not an issue in terms of the bus being disability friendly. So I might pause there and I'll hand to Councillor Kim O'Keefe, then we'll hear from Chris Hazelman, and then also from Greg Fitzsimmons from the Dyson's Group as well. So I'll let those folks speak and share a few words, and then we'll be happy to take any questions. But thanks again to everyone who's got behind Jabber the Bus and now Maxine Vaccine as well.
I think we're right to go. Thank you so much, Matt, and I'd also like to really acknowledge the amazing work that GV Health is doing, and collaboratively with Council. It's been a really wonderful opportunity to do all that we can for our community, and it's been an amazing experience to see how much we can actually support each other through this incredibly difficult time. But I have to thank our community that have stepped up for the vaccination. It has been incredible numbers in such a short period of time. When we were here a couple of weeks ago, as Matt pointed out, we had 5,000 and now we're only down to almost 1,200. So let's keep that going, because we know, for our community to be, protected, and for our community to do the things that we want to do. We're all very excited to be able to tomorrow, get back to our families and visit and all that type of thing. But we need to ensure that we are all protected, and we need to make sure that our community is safe. So please, with the slightest of symptoms, don't drop the guard. We still need to make sure that we are, responding to that so that we don't spread this virus. But vaccination is the key. Very excited to see the second bus launched today. I mean, the catchment is quite broad. It's broader than just Greater Shepparton, but it's wonderful to see that we can actually reach out to people that are having difficulty, and the success has been extraordinary. That will continue to happen with Maxine as well, Maxine Vaccine. So a great couple heading out doing their job. But look, I must say our community has been outstanding, but we've still got a way to go. Please, remember to support our local businesses. Businesses are opened. There's very strong COVID restrictions in place. I know it's still tough. There's still restricted numbers on things, but things are moving forward. And the best COVID recovery we can do is actually support our local businesses. More than ever, they're going to need our support. And heading into Christmas, let's really, step up and do what we can do to support each other, but also to support our local businesses. But we're doing an amazing job. I'm really proud and grateful of our community, and let's continue to support each other through this extraordinary experience that we've had, this last almost 2 years. So well done, everyone. And if you haven't been vaccinated, now's the call out to really, let's just close this small gap, and we can learn to live with the virus. Thank you very much.
Yeah, Chris Hazelwood, Manager of the Ethnic Council of Shepparton. We're delighted to continue the relationship, the collaborative relationship we've had with Goulburn Valley Health in providing bilingual staff both here at the vaccination hub at the Macintosh Centre and on Jabba the Bus, and now with Maxine Vaccine. Our bilingual staff play an important role in encouraging people from the multicultural communities to come forward to be vaccinated. They help people make bookings, they help people on the day fill out the paperwork, and they support and assist with interpreters as required. So we're very pleased to be able to continue that operation. A couple of congratulations I think are in order on the statistics that Matt provided. Great congratulations to the broader community who have come forward to be vaccinated, and in particular congratulations to our multicultural community. There's been concerns and anxieties that the multicultural community would be vaccine hesitant. I think the statistics today certainly dispel that myth once and for all. So we're very pleased to be part of the process, and we'll continue on. Our role will be exactly the same. We'll have some other priorities though. In the very near future we'll see a huge influx of people into this region for harvest labour. They'll come from interstate, or they're trying to come from interstate. Most of those will be from multicultural communities, so we'll be working very closely with those communities to try and ensure that their vaccination standard is up to the level that we expect. Thank you.
Okay, thanks for the opportunity. Just apologies for Roy, couldn't make it with us today, but I'll start with a quote he has given us. We're extremely pleased for the successful implementation of the first vaccination bus, and we're very grateful for Goulburn Valley Health for the opportunity to provide the second bus. Our Shepparton team have done a great job of preparing both buses and for the local community to access the vaccine. Now, we're getting towards the pointy end. We've got 95%, so this is about getting out to the community, and the girls, Goulburn Valley Health, everyone involved with Goulburn Valley Health, thank you for them the opportunity and getting to them communities that are hard to come to. So we're actually going to them, and yeah, very proud to be involved with it. Thank you.
So just thanks again to everybody for coming out. Thanks also to Kim, Chris and Greg. And what we'll do now is we're all happy to take any questions, should there be any questions. So Helen Roberts, Dr. Helen Roberts is normally our clinical director of anaesthetics, but is wearing a couple of hats at the moment and has been the medical lead for our vaccination program. So Helen can cover off those couple of questions, Max.
So the age populations we're targeting with our second bus are very similar to the age populations that the rest of Victoria is. We've got good coverage generally. We have the most rapidly growing age population is that group between 12 and 17, but it's really the people between 18 and 39 that we're looking to target with this, and that's often the people that are in work, so find it difficult to come to a fixed vaccination site for their vaccinations. Men are less vaccinated than women. That's true both in Shepparton and Victoria and all across Australia. So it's that real 18 to 39-year-old male population that would like to come and visit Maxine.
What's the feedback you've been getting from Jabba, from people that have been able to use it?
So we ask everybody that comes to Jabba what their thoughts are. Do they have any extra feedback for us? And the feedback has been overwhelmingly positive. The novelty of getting on the bus is one thing, but also the availability of it to be vaccinated at your workplace, be vaccinated very close to home, to not have to have that extra level of organisation or stress to come to a vaccination centre. It's been great.
Is that the aim of the two, is to basically bring vaccination to your doorstep? Essentially?
Absolutely. So for this bus number 2 for Maxine Vaccine, we'll have a published bus timetable. She'll have regular stops, and that will be coming to the GV Health webpage within the next week or so. So we can say where she is going to be and where you can come. And it will be a walk-up vaccination. There'll be no need to book, but the requirement would just be the time that they're at the stop.
Is there a geographic region that you're hunting, like individual postcodes that still have slightly lower rates of vaccination, or different community groups that you're still targeting as well?
Yeah, so our local public health unit that we run expands from south as far as Mansfield and Alex and all the way up to Cobram. What we have seen is the closer we are to Melbourne, the lower our vaccination rates are. They're still very high, but they're just slightly lower than they are as we go more northerly in our location. So we will go to the southern end of our public health unit as the first stops for Maxine over the next couple of weeks to support the great work that our hubs down there are doing.
Thank you.